it's Dr. Becky Spelman here. I'm one of the psychologists here at the clinic. The good news about panic disorder is that it's actually very easy to treat when we compare it to other types of difficulties. Although it's a really horrible thing for someone to experience and very scary and incredibly uncomfortable for people, there are practical tools that can help people break out of this disorder. In relation to helping someone overcome panic disorder, we always use Cognitive Behavioural Therapy, which is the treatment that has been proven by research to have the best impact for people. And I've certainly helped a lot of people overcome panic disorder. When people have panic disorder, they will usually be anxious about the physical symptoms of anxiety. Some people will notice their heart beating faster and worry about that. Some people will notice chest tightness, shallow breathing, dizziness, or other physical sensations of anxiety. And often when people have experienced this, they've been feeling anxious for quite a long time, maybe without even recognizing it, without knowing it, but that causes some very real physical changes in the body. And then these physical changes, which can come on out of the blue, can cause people to really worry and think that something is going to terrible is going to happen. Some people believe that they're going to faint when they're having panic attacks. Some people believe that they're going to pass out or have a heart attack or lose control in some way. So our job is to help people change their beliefs about what's going to happen to them. Because when people have anxiety in the form of a panic attack, it lasts for about 10 minutes and no harm comes to the person. It just doesn't feel nice. However, the worry makes the symptoms get worse and it becomes a really vicious cycle. So if we can stop people worrying about the physical symptoms and we stop them being anxious about the feelings of anxiety themselves, then the panic attacks will stop. So you may, for example, have two identical twins. One is having lots of heart palpitations and the other person may also be having heart palpitations, but one person is worrying about those heart palpitations and the other person is just saying, oh, it's fine, it'll just pass, it'll go away. It's the person who worries about it ends up actually having panic attacks and panic disorder. So in relation to the treatment, there's a couple of different parts involved. First of all, we challenge the person's beliefs about these symptoms and we really look at the worry and help someone to stop worrying about the physical symptoms and to interpret the physical symptoms as being completely insignificant and not something that is bothering them anymore. We also help people desensitize to those physical symptoms. So people who have panic disorder have a very low threshold for anxiety symptoms. They're kind of phobic of feeling those anxiety symptoms. So what we do is a lot of exposure work to help someone not care about those physical symptoms anymore. And how I'd compare that is to like watching a horror movie 100 times. The first time you react and you're scared and it might make you anxious, but by time 100 it's just nothing. You're so bored of it, it's just neutral, doesn't cause any reaction anymore. And it's the same with these physical symptoms of anxiety or the physical symptoms people experience in panic disorder. We help people experience those symptoms in a safe, controlled environment in the therapy sessions, in a very practical and active way. So we're not just sitting talking about it, we're actually doing a lot of experiments that would help you desensitize to those feelings. If there's particular situations that bring on the panic, so for some people it's going on public transport, maybe going on the tube, for other people there would be other triggers, we would help you go into those situations, use anxiety management techniques and get a completely different outcome. So essentially your beliefs become, I don't mind these symptoms, I'm not going to have a panic attack, I know I'll be just fine, rather than worrying about it. So there's a lot that we do on the behavioural side of things, there's a lot we do on the thinking side of things, and there's a lot that we do on the physical responses side of things as well. So all of this combined will help you overcome panic disorder within maybe about 6 sessions. We have treated panic disorder much faster before. I've sometimes treated it in 1 session. I've sometimes treated it in 3 sessions. For some people it is more difficult and it takes a little bit longer, but it's a very short-term type of therapy. We focus on one specific goal and we take you from the start right to the finish, where you would be no longer concerned about panic attacks and you'd be panic-free. Some people stay for another set of sessions to help with other anxiety, because once we cure the panic attacks, people can still be affected by anxiety, and we may have to do a little bit more work to help you with anxiety. And again, it's about having a higher anxiety threshold. We're not trying to get rid of anxiety, because actually it's a human condition. And it's not a bad thing. We have anxiety for a reason. There is protective reasons why we feel anxious and why we need anxiety. That's why I always say to people, don't take medication for anxiety. Find the practical ways of overcoming it so that you're not worried when you feel anxious anymore. So I hope you found this information helpful. I would suggest that you come for an initial assessment with one of our therapists who specialise in treating panic disorder. We've got many people at the clinic who are highly specialised in using the gold standard protocol, which is Cognitive Behavioural Therapy, to help people overcome panic attacks. And our therapists are accredited cognitive behavioural therapists. You want to make sure you're going with BABCP accredited cognitive behavioural therapists, because those are the people who will have the gold standard training to help you overcome this disorder. The good news is it's treatable, and also people overcome it. You don't have to be stuck with this for life. We're very, very skilled at helping people become panic attack free. Okay, well, feel free to get in touch if you do want to book in for an initial assessment. Thank you.